That's it.
Anyway, okay. Sorry about that day. I don't know. It is that eternally that problem is there. And I was trying to record it and put it in the PowerPoint. Then that was also size was large. So anyway, getting on to the infant and young child feeding. Now you all would have done the breastfeeding lecture. Am I correct?
Yes, sir.
So what? So basically, you all already know that why you should be continuing breastfeeding and would have been told till about at least 2 years you have to continue and define complementary feeding and explain why there is an optimal age for children to be started on complementary feeding, and there are certain messages that you should give to the parents. If you need any clarification, then and there you can stop and ask from me. That would be, I think, easy. Right. So complementary feeds usually till 6 months of age we continue giving exclusive breastfeeding, and after 6 months all babies require complementary food because all the nutrients cannot be provided by breast milk alone. And to continue milk as another food item till about 2 years of age, and there is no need that when the complementary food starts, you have to stop the breast milk and start on formula milk. There is nothing like that. Whatever it is, milk has a certain place in the diet. The prominence is coming down after complementary feeding starts, but it need not be replaced by another animal's milk. Now, complementary feeding should be introduced at the time correctly, and it has to be given in adequate amounts. It has to be safely prepared, as well as the other composition should be safe, or the ingredients should be safe, and it has to be properly fed, because feeding itself is another development milestone or the development component which will interfere with the behavior of the children, and that has to be inculcated or trained right from the age. Now, breastfeeding continuing for 2 years, it is not only for nutrition, but also for the other non-nutritive benefits, such as reduction in allergic conditions or reduction in non-communicable diseases like diabetes. So it is very important. But now, when we are giving breast milk or any food item as the sole source of food, it will provide the nutrients, it will provide the water. If you are using something in that nature, you can give it at demand because there is no need for any other food diversity to be introduced. But once complementary feeding has started, we know that various now we have basically about 6 food groups, and in that 6 food groups we have to make sure that every group in the correct proportion is given. So in that process, if you continue to give on demand breastfeeding, then the child will be filled, the stomach will be full, and then the child will not be taking the other food items. So the diet diversity will go away. And child, if it is when hungry only will take, or if it is certain taste only they will take, but it will not be a good diverse diet. So because of that, as I said earlier also, breast milk now takes a backseat as another food item. It is not getting the prominent main food or the one and only food. So because of that, you can't continue the on-demand breastfeeding, but you have to structure it and place it in proper places which will not interfere with the normal food, because the normal food or the complementary food is much more important as the calorie density is high, the nutrient diversity is high, and that has to be. But breastfeeding because people still think that the milk is the most important and breast milk could replace everything. But when it comes to the complementary feeding period, that is not the case. So that's why I have said you have to structure this feed in order to provide the proper dietary diversity as well as the nutrient needs. What will happen otherwise is that the child will every time begins to suckle on the breast, even when he is feeling lonely, feeling sleepy, all that. So ultimately, the breast will become a comforting, uh, or the breastfeeding would become a comforting thing rather than a nutrition thing. And then, as a byproduct, what we call as comfort suckling, and then as a byproduct, they will be swallowing certain amount of milk, and that will fill the stomach, and then the satiety is always there. So he or she will not feel hungry enough, and the appetite will go down. So the important thing is from the time you go on exclusive breastfeeding, once you have started on complementary food, the on-demand breastfeeding comes down or will stop actually. It will be a structured breastfeeding at correct intervals as to give way to the main food items. So complementary feeding means introduction of food other than breast milk. Complementary food is the food that you have to use for them. So they will help in bridging the energy gap. They will also help in bridging the uh, nutrient gap. And also, now we know that the child is on a total liquid diet in the first 6 months. And then our target is to make sure that they eat the normal adult diet by about 1 year. So that is a total liquid diet into a total solid diet. But that cannot happen overnight. So that's why we have a transition period, what is called the complementary feeding period, to go on from a total liquid diet to more or less a total solid meal. So the consistency, composition, all that will gradually change, as well as also certain food items may not be agree with a younger child, which could be given only after a certain age. So you have to phase it out and introduce at the correct intervals. So now we were talking about energy and nutrition gap, and if you look at the requirement, energy requirement over the first 24 months, you can see there is a certain amount of energy requirement which gradually increases with the increased size of the child. And in that process, what happens is initially the breast milk will be providing everything. But you can see that over a period of time, after about 4 to 5 months, gradually the composition or the energy provided by the breast milk will also go down. The main reason is the quality of the breast milk will gradually come down, as well as the quantity of the breast milk that is secreted will also come down. So because of that, whatever energy requirement that was able to fulfill at 3 to 5 months will even not be able to fulfill thereafter, but it will gradually come down. But the overall energy requirement of the child goes up. So there will be a ever widening energy gap. So this gap has to be filled. If we don't fill, then the child will try to satisfy by this small amount of food. So the main target for the body is to survive. So it will function its basal metabolic processes, but it will not have a adequate growth. So the first thing that we will see is that the weight begins to falter. So that means the energy requirement is not being met by whatever food items we have given. So we have to strengthen. So that's why, so this is what we have to bear in mind. We are trying to fill this gap with the complementary food. So usually we have been giving exclusive breastfeeding till about 6 months, because we have seen that whatever the milk will be able to provide all the required nutrients up to 6 months. But the exception is about iron, which I will talk to you a little later. But majority of children should be able to survive and have a good adequate growth alone on mother's milk. However, there will be a minority who will have a growth faltering where either the child needs large amounts of energy or the mother's, usually the latter, that the mother's milk quality will go down. So as a result of that, she has to, he or she, the baby needs some extra calories. And so that's why after 4 months of age, the baby can be introduced on complementary feed. So what you have to remember is that any baby after 4 months is ready to take complementary food. But if the mother's milk is satisfying the requirements, then we don't have to risk the baby by introducing any other extraneous food items. So as a result of that, we continue complement breastfeeding till 6 months of age. But if the growth is faltering, so that is why we have to begin measuring them very carefully at 4 months, 5 months, and 6 months. And if there is a slightest drop in the weight, that means the child would have been fed correctly, but of course the amount the mother is producing is not enough. So that is an indication. So this is something which you have to make sure you get it into your heads quite clearly. Don't think that till 6 months we can't start complementary food. No, we can start at 4 months. Only thing is, if it is not necessary, we go till 6 months. But if it is necessary, where the growth is faltering or mother is not available for on-demand breastfeeding, that is the mother is working, you all know that the mothers have either 84 days of leave or 84 working days of leave. So if it is 84 days, it is dead on 4 months, actually 3.5 months or so it happens, or they will be closer to 4 months of completion, they would be going to work. So then in that case, you have to make sure that the child is not deprived, and the child need not be started on formula milk, but could be started on complementary feeding. So these are the two exceptions to the rule. Now, what are the disadvantages of starting complementary feed earlier than normal? It will take the place of breast milk, and then because breast milk, as I said, it is not only the nutrition, it also provides various other factors which are important: digestive factors, growth factors, many of those things. So that will reduce the intake of breast milk. So that will increase or it will deprive the nutrient intake in certain way, either the intake as well as the absorption. Then there will be increased risk of illnesses. That is because there are less protective factors. We know some of the factors from the mother which lives in that environment. She can provide the protection to the baby through the breast milk. So then other foods are not as clean as breast milk. And then sometimes it is difficult to digest. That's why I said breast milk has certain digestive or material or components which would assist in digestion. So that will be deprived. So that's why early introduction is also not very good. And also there can be other difficulties. Sometimes they may not be mature enough to take solid particles and they can get even choked. And the other thing is mother will have the increased risk of getting pregnant due to the removal of the lactation amenorrhea. Similarly, if you pass a certain window and introduce the complementary food too late, that will also be disadvantages, because there are, as we said, breast milk can't provide all nutrients, so they will be deprived of certain nutrients. It will slow the child's growth and development. It increases the risk causing deficiencies and malnutrition, and may not learn to take the solid due to the hyposensitivity of the mouth. Because there is a window that had been identified between 4 to 10 months of age. And if you don't introduce during that window, then there will be issues where the child will not learn how to take solids. So you may have also come across during your clinical training that sometimes even 1.5 year old children, they are finding it very difficult to give solid. If there's a small particle in the food, the child begins to throw it away. That is because the child has not got used to the feeding, and also they are not learning how to munch, because if you give a very very mashed diet, or even if you continue to give the breast milk alone, breast milk only have to be swallowed. There is nothing, no mastication, no change in the consistency have to be done by the person who takes the food. So as a result of what will happen is that the child will not learn how to take solid meal, and then there will be a huge problem later on, and then other things like their disliking and the growth problems will occur. Now we have to bear in mind that the amount we have to give to a child is dependent on the size of the stomach. Usually, a baby's stomach is about roughly 10 to 15 grams per milliliters per kilogram. So that would be usually less than 200 or so milliliters would be the size. So in those cases, we have to make sure that we give properly energy dense food items. So if we give a lot of water content, if the food item contains 30-40% of water, that means we know water does not contain any calories. So as a result of that, the child will be deprived of important calories. So you have to make sure that you give the correct composition of the food. So that is why the consistency is important. Now we have been giving a total liquid diet, and now we have to go for a solid diet, and we are trying to match the energy as well as other nutrient deficiencies. So to achieve optimally, and we have another problem where the stomach is also restricting the amount the child could be offered. So that's why we have to have a good thick consistency food, which this type of a consistency means less water. But of course, having said that, in the initial week or two, we may have to go for a little liquid, little thin consistency, because the child had been totally taking a liquid, that is milk. So all of a sudden he can't go rush into this. So over about 1 to 2 weeks period, gradually the water content of this should be reduced and moved on to this. So that is what you have to tell. Now if you have seen the CHDR, there is one picture where they have put a cross and said not to give. Yes, that is true. But you can tell the parents, maybe the first initial week you give like that, but immediately you try to come to the other picture which has put a right mark, correct mark, and then to go on to that. So that is what we have to tell the parents. Then to increase the energy density, we can add oil. So usually we can put coconut oil, which is a medium chain fatty acid containing oil that will help AC absorption, and it is culturally accepted, or even any other long chain saturated fats contained like butter, margarine. But always try to go for monounsaturated fatty acids if we are available, but that would be much more healthy in addition to the coconut milk or coconut oil. So then what you can do is, once it is boiled, once the food is cooked, and after taking away from the hearth, you can add the oil, because otherwise if you put the oil into uh, the boiling pan, it may get converted into different components, and then it can produce different harmful oxidative stress creating material. So because, as well as certain loss of certain fat soluble vitamins. So it is always advisable, once you take it away, only to put the oil that you are going to add in. Then, as I said earlier, also there is another problem with the iron. Iron is the major problem, which is the only drawback in the exclusive breastfeeding program, because you can see this dark black line denotes the amount of iron that is given by the breast milk. So how much better nourished mother is, how much conditions are ideal, breast milk is a very, very, very poor source of iron. So unless a person comes with iron stored during the latter part of the gestational period, there will be severe iron deficiency. So you have to make sure that the child is a term baby in that case and well-nourished mother. Their iron content would last for about 3 to 5 months. But afterwards, it gradually comes down and it's almost very, very negligible amounts there. And the breastfeeding is not very good. So that's why sometimes even earlier than that, you have to introduce iron. And we have programs even for the normal full term, normal birth weight children. We give multiple micronutrients at 6 months, 12 months, and 18 months, at each time given for 2-month period in order to improve, especially iron, vitamin A, and zinc. Of course, that is how the multiple micronutrient is formed, and that is important because no sooner you introduce the complementary food here, this gap cannot be filled because the child is not used to take complementary food, and then the food items are also not accepted always by the child. The volume we can't give. So that's why at this point you have to provide medicinal iron or iron drops in the correct volume or the correct amount, and then support them, and then that will help to build up the iron stores, improve the appetite, and then with the diet you will be able to provide the required iron. So this is the main problem. So if there's a preterm baby, then of course this will also not be there. That means from birth onwards, you have to keep on supplementing the child. So animal food is a good source of iron also. In addition to that, it will have good high quality protein. So always we have to encourage addition of animal food. Even sometimes there may be parents who are vegetarians or vegans. You have to tell them, okay, till the child grows reasonably for about at least closer to about 10 years, ideally, you should be giving them the uh, animal protein. And usually, I, of course, tell till about 16 years because it is a choice that has to be made by the child if it is for non-medical reasons, and then they have to take the choice. And if they are deprived of proper growth, then of course that is also an injustice that is happening. So I think basically not that we should be eating large amounts of meat products, but a basic requirement of meat products is required because humans are herbivores, they are not carnivores, no, they are total vegans. So better balance have to be striked and they should be given that opportunity. And once they want to decide on that, they could decide as adults, but we should not be deciding whether they should end up as uh, herbivores or whether they are whether they are taking both types of food items. So then nuts and lentils is also important. So this will provide certain amount of oils and fat soluble vitamins. So that way you have to give a mixed diet. So what should be is that a mixed diet, both animal proteins as well as plant-based diet should be given to a child, but not only one type of, or one type in the sense it's mainly uh, vegetarian type of a diet or total herb-based diet should not be encouraged. So basically, it is a omnivore diet that we have to encourage. Then when it comes to the gap of vitamin A, you can see that the vitamin A needs are fulfilled to a great extent by the breast milk, because breast milk, although a very poor source of iron, it is a good source of vitamin A. And furthermore, it has been improved by the breast by giving vitamin A mega dose to a mother soon after birth, 200,000 international units is given, which will improve the breast milk vitamin A, which will be so then the infant will get good adequate amounts of vitamin A, and now we hardly see vitamin A deficiency in the early life. So definitely this gap can also be fulfilled by the diet diversity, and if there is any gap remains, that could be fulfilled by the normal diet, which is of course a plant-based diet. So the iron as well as vitamin A could be provided through dark green leafy vegetables as well as yellow color fruits and vegetables respectively, and that will provide different taste, different texture, and improve the nutritional state. So you have to encourage people to add on these food items and not to stick only to one, because you would see most of them will be giving either pumpkin and carrot, and fruit side mainly papaya, but it has to be, although it will provide most of the yellow color stuff, it is not good diversity, but you have to extend the diversity to make sure that the child will like a lot of food items. So in the complementary feeding, one of the most important thing is the quantity, then the variety and the frequency of feeding. It is very important to use a variety of food because that will improve the nutrient content. We know that different food items in the different 6 food groups have different nutrient profiles. So then to provide all the nutrients in correct balance, you have to give a diverse diet, not only 1 or 2 or 3 components of the food components. So it is important that you give that. Then child learn not to select food also, because if they give only 1 or 2 food items, child will get conditioned to that particular uh, food item, and then he will begin to select. So to avoid that, you have to, from a very young age, because young children, especially under 1 year, they are not used to a particular taste. They can take many variety of food items, and that has to be encouraged, and that will help the mother later on to give any type of food uh, without any difficulty. Otherwise, what will happen is mother will find it extremely difficult to feed the baby later on, where he will get used to 1 or 2. Actually speaking, this has to be started from the second trimester in the mother itself, because many of the food items, their flavors will be there in the amniotic fluid. The infant begins to swallow, the fetus begins to swallow the amniotic fluid, and that the taste and the smell is established by about 20 weeks of gestation. So by that time, if the mother also chooses and eats 1 or 2 food items, the baby would get conditioned to that particular food item. So that's why it is very important. So the same thing you could see, that children who are used to mother's milk totally refuses if you introduce cow milk later in life. So those are some of the things you have to consider. Meals, 2 snacks, and as I said earlier also, breast milk should be structured. That has to be given at the correct time, not here and there whenever the child wants. Because sometimes what happens is people replace water with breast milk, which is not correct, because breast milk is actually a food which contains a lot of fat, and you know fat takes a long time to empty from the stomach. But if you give water, water will help to digest the food and help or potentiate the gastric emptying. So that means the child will have more food to eat, because the child will feel hungry more, and as a result, child will take all the nutrients in the required amounts. But if you do not do that, but continuously give breast milk, then of course there will be a issue of getting the correct amount of nutrients. So then the outline the quantity of the complementary food. Usually first few days, first couple of weeks or so, it will be few teaspoons. But of course, once the things are established, if the child is kept hungry adequately, then of course the child will be able to take up of meal, that is from a 200 milliliter cup, and then again also you have to make tell so then by about 9 months they would take about 3/4 size of a cup, and then by about 1 year they can take about one whole cup. Also you have to tell them whatever volume that they are preparing for child should be properly constituted, that it should not only be rice or starch one, about half or so should be starch, then adequate amount of vegetables with fish or meat or whatever protein source. So that way it will help. Then if you look of the main nutrients by about 12 to 23 months, if you are just thinking about only breastfeeding, you can see how deficient they would be in these 3 or 4 main nutrient components, that is energy, then the protein, then iron, as well as vitamin A. So this white area or the gap need to be filled. So if we go for 3 meals, that is breakfast, lunch, and dinner, and then about 4 breastfeeds in between, we will be able to provide most of the nutrients, but there will be a rather big gap of iron still, because breast milk is not a very good source, and especially in our part sometimes the food items may not. So we have to have a special emphasis on the providing the iron. So similarly, to more improve that, you may have to increase the, because you can see still there is a little bit of an energy gap here. It is not 100% with 3 main meals. So to fill that gap, we have to then give some additional snacks. So that's why the 2 snacks that has brought here has been able to fill. Now you give 3 main meals and you give 2 snacks in between, and then give 4 milk feeds. So that's why I said the breastfeeding also should be structured. They have not put a single circle and said every time you can give breast milk. It is actually at particular correct intervals that has to be given. So then the timing is also crucial. You can't give the breakfast at 9 a.m., then the lunch at 3 p.m. That type of a thing is wrong. So you have to tell them it is important that you condition the child also to take it at regular, because in another 2-3 years time the child will begin to go to school or preschool, and then it will be again erratic. So most of these children who take late breakfast will ultimately be breakfast skippers when they begin to go to school. So you have to train them right from the younger age. So ideally, after a good night's sleep, which I would recommend about 7 hours, the child should get a breast milk feed maybe around 4 o'clock or so in the morning. Then at the next time when the baby feels hungry, maybe 6:30, 7:30 period, you straight away give the breakfast. Then around late morning, that is around 10 o'clock or so, or mid body say, the child may again feel hungry. So rather than straight away giving breast milk, it is better to give a snack. So preferably a fruit snack could be given, which also has a reasonable amount of electrolytes in addition to the calorie, and also some amount of micronutrients. So that will help to bridge any gap there. Then the mother can give some breast milk at the same time. Then you go on for the midday, maybe between 12 and 1 or so. Then again in the mid-afternoon or evening, early evening, maybe around 4 o'clock or 3:34, that type of a time, you can tell them, okay, you can give another snack, maybe a mashed potato, mashed sweet potato, a peeled out banana, that type of a thing. And then you can ask them to give some breast milk. Then at night again, you can give the dinner, that is around 7:15, 7:30. That time would be better after having the evening snack. So in between, you can see that there is not much of breastfeeding taking place unless it is structured at particular intervals. And especially even after, then of course, the child can be given some breast milk, maybe 8:39 or so, and put the child into bed. So if the child sleeps from 9 p.m. till about 4 a.m., there is nothing to be worried, because that sleep is also very important for the growth of the child. And then by the morning, child will be feeling very fresh and wake up and would continue the day. But if they keep on disturbing the child and keep on giving breast milk in, in the middle of the night, then every 2 to 3 hours, child will pass urine, wake up, and that will be a disturbed sleep. So the repercussion of that is that during daytime, they will be really, they will have somnolence. They will have daytime somnolence where the child is feeling sleepy. So he's not interested in eating or drinking, but he would just take a little bit of breast milk and sleep. So that is why it is important that you encourage parents to give, because giving, sometimes parents think that they are depriving certain meals. No, it is counterproductive. If you give small meals at night and disturb the child, it is not going to give much benefit, because especially if they wake up at night, the energy consumption also goes up. So whatever you are giving will be wasted on energy, and the child will not get a net benefit. The other important thing that you have to emphasize is, when the children are given any solid meal, that afterwards they should be given little bit of water. It's not the milk directly. If milk is given, it should be at least 1 hour after the main meal, or it should be definitely 2 hours before the main meal, in order to make sure that they are not feeling full by the time they are breakfast. So if you give breast milk after the meal, then of course, as I said, it is a high fat containing food item. It will discourage gastric empty, and then the child will not have a proper emptying and will not feel hungry by the next main feed. So that's why, to increase and improve gastric emptying as well as digestion, you have to give milk to the child. So that way it will be done. And of course, what and how to prepare and the composition, consistency, all that I would advise you to read the CHDR, because that will give a fair amount of uh, knowledge and what you should be communicating to the parents. But the basic principle is that you should be spacing out the meals, and they should be coincide with the adult feeding times. So then naturally the child will continue to have proper disciplined eating afterwards. So mainly we will sort of try to strike about 3 main meals with 1 or 2 snacks in between. And extra water, as I told you, in countries like ours, maybe 400-500 of milliliters of water is important, because otherwise, if we don't give water, there is no improved gastric emptying. If we don't give water, there will be, and we do not quench the thirst, the child's appetite for the next meal will also be low. So it is important that, and also probably the poor habit of taking water by children now would also be established during the initial phases, where they would have been insisted giving breast milk instead of water, and now the child does not have that liking to take water. So it is important that you encourage, and not with a bottle and a tea, but with a cup which is having a spout like this, and tell them to take it. Then the situation is very important, that the child should be encouraged to eat with the others, and that has to be done where then the child will learn that the other people are also doing the same thing, and children like to mimic the adults or older kids. So it is important that they sit together. But in this country, you all would have seen that many people make the eating is a huge problem, or feeding a baby is a huge exercise, and everybody, the whole household comes into a standstill, and 3 or 4 people get together to feed. That will create a lot of psychological stresses to the child as well as the parent, and that will be very counterproductive. So you have to tell them whatever they eat, they will eat properly if you keep them at the table and allow the child. And when the age comes for finger foods, maybe around 8 to 10, 12, 10 months or so, you should encourage the child to pick and eat while the others are also taking their meals. So independent feeding is very important, that the child should be encouraged. It should not be told that the child can't feed on its own, so we have to keep on feeding. No, that will happen. Then what will happen is even 10, 12-year-old children may have to be fed by their parents. So you have to discourage that from a very young age. So low birth weight babies is also important to feed, because they may need more energy sometimes. Their mother's milk may not be able to provide them with the required calories, and they also will need some additional micronutrients. Those have to be supplemented and provide them with the required nutrients as well as the energy. Then one of the most important thing is feeding during illness. Because again, culturally, sometimes we tend to stop feeding the child because there is thinking that it will interfere with the recovery of the illness. But of course, it is very important that you tell them they should continue feeding the child during the illness. And it is important that certain symptoms like vomiting, fever is controlled before offering the food. And then depending on that, especially if the child is vomiting, you may have to give small frequent feeds, because large quantities will make them to vomit easily. And then giving fluids will help to keep them hydrated, circulation will improve, and also excess heat would be lost from the body, and that will help to bring down the temperature also. So it has to be carefully carried out, and then there should be a lot of patience, because these are ill children. And you can offer a child not go on a very, very strict diet, but to offer children what they like to eat and drink, because your whole idea is at this moment to provide the adequate amount of calories with some other micronutrients. So then, of course, you have to continue the breastfeeding. So during recovery, a child needs to be given extra breastfeeds and extra meals, extra amount at each meal, and use extra rich food, that is very, very calorie dense food items, and with very, very good patience, in order to make sure that the child is not stressed and take the food as it is given. So I think premature babies, they would have been discussed probably in the lactation or the breastfeeding lecture. I just wanted to say that usually suckling on the breast is a reflex process. So if that reflex is not developed, then the child will not be able to take the milk. So children less than 32 weeks of gestation have not got the reflex, but those who are above 22 weeks of gestation would have had developed that. And as a result of that, they would be able to suckle. But the ones between 30 to 32 will be able to swallow easily, but they may not have the energy and the power to suckle on the mother's milk. So you may have to express and give it with a cup and spoon. But children below 30 weeks or infants below 30 weeks will not have much ability to swallow and suckle. So they preferably given tube feeds. So having said all that, if you concise this and give the correct messages, which would be the summary of that, you can confine that into 10 messages. So one of the first thing is breastfeeding for 2 years is helpful for the development and the growth of the child and to make him very healthy. And this motivation should be given right at the commencement of breastfeeding. You have to tell them if almost all mothers can do successfully breastfeed. So you have to make yourself, your mind should be set in to give the breast milk to the child. So once you have told that, in search of formula milk when the child becomes 4 or 5 or 6 months, but they will have the confidence and they would continue breastfeeding. And you have to tell also that breastfeeding takes a back seat when it comes to the complementary feeding period, and there will not be same, because eternally they will come and say breast milk is less. Naturally it will be less, and that is why we are starting complementary foods. But people will go into wrong practices if we don't tell that properly. So then, of course, starting other food in addition to breast milk after completion of 6 months, or we have to also tell them that by 4 months onwards, you have to strengthen your growth monitoring, and if there is any faltering, have to seek advice. It has to be of the proper consistency. Then variety should be there. Animal as well as plant-based food items should be there. Then you have to give the variety to food. If you give plant, only 1 or 2 plant items cannot be given. Variety, actually, you should know that there are 6 different colors of fruits and vegetables in this country, which will have 6 different properties. In addition to nutrition, it will also have properties like what do you call antioxidative properties that will help to improve the health of the individual, and also that will help to develop variety, and then the child will learn how to eat all. And also when you have diverse colors in the plate, the child will be attracted to that and he will try to taste from each and every. So a child will need about 2 to 4 meals, main meals or bulky meals. That is, you may have to increase if the child is undernourished, and with 1 or 2 snacks in between. With the child grows, the volume have to be increased, and then the eating is a behavior that we have to develop correctly right from the younger age. So that has to be done. So that's why I said the child should understand this is a process carried out by all the members in the household. So that is why he or she has to do it. And that can be done by inviting the child also to the main table whenever the other people are also taking food. So you have to encourage them to drink and eat during illness and provide extra food after the illness when they are recovering. But of course, the drinks have to be encouraged and given every time throughout the day in order to improve the quality of the health, as well as to improve the functioning of the internal media to keep everything in good functioning order. So those are the 10 main key messages that you may convey to the parents, as well as that is actually the whole summary of this main lecture, but you can add on the 11th one as improving the fluid intake in additional to these messages. So that brings to the end of this lecture. And if are there any questions you all want to ask, any clarifications you all want to make? There have been 2 questions regarding preterm babies. How are the months considered from the time they are born or the time that they would have completed 9 months will be special. So whether you are making a correction for the maturity is what you are asking. I think you don't make any corrections to the maturity when it comes to complementary feeding. It is only for the development and the growth assessment that you would make it. But of course, you don't make any other changes. Is low birth weight an indication for delaying weaning? No, it may be even early weaning may have to be started, because you have to see the low birth weight reason. It may be a maternal reason. So in that case, mother's milk may also be poor quality. So in those cases, or the mother may be on certain medications where for her illness, which would reduce the breast milk availability. So that's why that type of targeted ones need to be closely monitored, and then they have to be corrected. And weaning is never delayed in those or anybody if it is not so. Right? Any other questions? All are sleeping well? Hello?
I think, sir, that's all.
Is slow birth weight an indication for delaying weaning? Is force feeding recommended in failure to thrive? Well, I told you low birth weight, prematurity, none of them are indications to delay complementary feed. There is no delay actually, or there is no delay you can make, because you have to start by 6 months definitely. There is nothing to say that okay, they are okay by 6 months, we'll wait till 7 months. No, even if they're perfectly normal, you have to start by 6 months, completion of 6 months. Only the thing is that you whether you are going to start early is what you have to decide. So for that, I have given you the reasons what we have to consider. Then force feeding, you never encourage force feeding. That is wrong, because you don't have to force feed. If you structure, let the child develop the hunger, and the parents understand the hunger cues like yawning, opening mouth, trying to suckle on the fingers, and that type of thing, then you will introduce the food. But force feeding will give rise to a lot of psychological problems, because it's a very stressful act. And then you can see a mother will get angry, her anger get communicated through the facial expression. So that's why, and the child will feel it is a punishment. So that's why it is important that all get together and have their meal. Then what is the ideal time period to substitute with formula milk? There is no reason to really give formula milk, because that's why I said till 2 years, mother's milk is quite enough. And thereafter also, milk need not be a promoting idea, a food item. It is because actually milk is a liquid diet. So somebody who could take a solid diet, no need to take a liquid diet. But certain things, such as certain proteins and other factors, would improve. So instead of actually giving milk, you can actually promote fermented products of milk like yogurt and curd, or otherwise it is better to give liquid milk instead of giving formula milk, because formula is it's a mixture. It is not the fresh or the direct natural source of milk. Is it not good to give biscuit to infants? Actually, for infants, I don't think you need biscuits, because biscuits have probably several things. One thing is most of these biscuits will have sugar. So they will get used to that taste. And then most of these biscuits will have cow milk added. So then you are indirectly giving cow milk, which would lead to probably development of what you call sensitization or allergies in these children. So it is important that you do not, it is not really important to give biscuit, because biscuit has actually become a menace now in this country, where most of the children keep on eating large quantities of biscuits, which will ultimately have been resulting in unnecessary weight gain and putting on and becoming obese. Is it okay to add sugar and salt? Sorry, I forgot to tell that. We usually discourage people to add sugar and salt. The whole idea is because if we train them, if we teach them certain taste, then they would be taste craving people. So they will be looking for the taste, and then that will hinder their ability to take food. So it is important that you discourage, you don't give. But having said that, sometimes you may have to add a little bit of salt, not sugar, salt, in order to remove the bland taste. අර අපි කියන්නේ සිංහලෙන් පරුරහ කියලා. To remove that, you have to give it, but not to feel the salt taste, because you should not give and create a salt taste. Then the children will become craving to salt. They will take salt, then they will be thirsty and drink a lot of water, and then they will stop eating the food. So it is not encouraged at all. So, I mean, even as after 1 year, you can allow them, but it's the whole idea of adding salt and sugar is to get rid of the bitterness, sourness. It is not to learn the taste. Now, even as adults, I think both these ingredients will, because salt will definitely lead to long-standing hypertension development. Sugar will lead to the development of overweight, obesity, then things like hypertriglyceridemia and diabetes mellitus. So you have to discourage them. Any other queries, questions? Does oats cause weight loss in them? Well, I don't have much experience as oat whether they cause weight loss, but it is a fairly fiber containing. But also there are new research that shows that the food item, if it is coming from the same native environment, that would be much better. Because we as animals have evolved over a period of time, getting used to a certain food item, and then that has organized the gut microbiome in a certain manner. And when we introduce some other foreign food item, that will get totally lost. So what the gut flora has a very, very big, plays a very, very big role in the health and disease of an individual. So much so, sometimes they have shown that there is research to show that malnourished children, when they are fed on a luxury diet, they were not gaining weight properly. But of course, by introducing these common native food items, which they are familiarly had been taken for generations, then only they will improve. So that has a large portion to play with the gut microbiome, and therefore foods like oats and all these Mediterranean and westernized things are nice to eat things, but they are not really good or essential to eat things. So I think you should discourage people going on for these fancy things which does not have that much of a biological value. Are there other foods never to give? Well, the thing is this, there are at different time periods you have to introduce the food. Now, there is no 100% very, very well established basis, but foods like now cow's milk, it can be given, but it need not be given under 2 years of age. Then eggs, you can give it, but we don't encourage that to be given under 7 to 8, at least 8 to 9 months, especially the egg white. Then yogurt, you can give it 6 months onwards, because now you may ask, I am saying not to give cow milk products, but I am saying to give yogurt. Yogurt is actually a fermented product. It is partially digested, so the protein will not have the allergen that much. And on the other hand, it will help the gut microbiome also with the lactobacilli and all coming from that. It has the pre and the probiotics. So you can introduce that, but we don't encourage or we don't introduce yogurt before 6 months. So every food has a time to be introduced. And then on top of that, if they have developed any allergies or if there's a family history, strong family history of allergy to a particular food, it is always better to delay and test and give it. And on the other hand, there is no food item that you can say you can never give, because if you say it's a food, it can be taken, but there may be personal variation. If there is something that cannot be given, that means it is not a food, but it is a poison. So poisons are the ones that will never taken as food. But on the other hand, anything that can be. But of course, having said that, there would be personal variation, which you have to test and give it. But if it is something labeled as a food, that means it is safe to be ingested, and it can be taken. How should you offer weaning food? By spoon and cup or any other way? Yes, it has to be given spoon and cup, where you have to mash the food. The food should have now the whole exercise is to sensitize the baby's mouth to take solid sort of particulated material, not just a liquid flowing liquid. So as a result, what I always tell is that they should not use a liquidizer and blend the food. No, they should use a strainer and try to strain and separate the coarse particles or large particles from smaller ones. But they should be giving the food in the correct consistency. So the best thing is that they can mash it. So there are small bowls which have spikes. කටු වගේ තියෙනවා. ඒවට දාලා you can ask them to mash it with a spoon. එහෙම නැත්නම් they can use the simple uh, nabilia which is there in the household and mash it against the walls of that. And then they should use a cup and a spoon, because this is another process. And if you put it into a bottle and try to give it, you are giving liquid, you are not giving solid, you are not training the baby. And then cleaning and other problems are all also there. So it is always should be advised that they should use a spoon and a cup, put it into a bowl or a cup and then feed with a spoon. Any other questions? So basically, a child can be brought up in home if the mother is at home without using a bottle and a teat. I am talking out of my own personal experience, because there is no need, and those should be totally discouraged, because the cleaning problem is totally there. And then what happens is the child keeps the bottle in the mouth for a long period of time. And then during the teething period, the teeth will also get malacclude by keeping the bottle for long hours in the mouth. So always you discourage the use of bottle and teeth in each and every child. Anything else? Okay. All have gone home, I think. Okay. Right. Shall I wind it up then?
Yes, sir.
I
Yes.
Yeah, you find the dudes out. All the others are sleeping while you're talking. Okay, right.
Thank you, sir.
Right, bye.
Thank you, sir.
Thank you, sir.
Thank you, sir.